The decision of the United Kingdom to put Nigeria on red list over Omicron variants of COVID-19 is attracting criticism from the people, including senators and members of the House of Representatives. Governors of the 36 states of the Federation have also condemned acts without any justification, describing it as arbitrary stigmatization of Nigerians. Meanwhile, Saudi Arabia has also suspended all flights from Nigeria due to the new Omicron variants. This is becoming alarming.
Yeah, I think that there is nothing wrong in countries taking measures to protect themselves against the Omicron variant that we are still learning more and more about it. From what the World Health Organization tells us, this is one strain of COVID-19 that has already demonstrated that it can successfully evade the vaccine. So the fact that you are vaccinated may not confer any kind of immunity on you once you contract the Omicron variant of COVID-19. But I think the concern of most Nigerians and the governors now is that targeting Nigeria appears to be punitive and discriminatory. It's now confirmed that Omicron is present in 57 countries of the world. Yeah. So how many of such countries have these countries moved against? But everyone just thinks that, look, it's Nigeria that they've got to ban. Why, for example, would these countries ban Portugal? For example, because Portugal already had more than 70 cases at the time when Nigeria had just 3 cases. Portugal already had more than 70. So if we are seeing countries where this Omicron strain of COVID-19 is present, not being treated the way we are being treated now, then people will be worried. Countries reserve the right, as I said earlier, to put measures in place. But those measures have to be consistent. They have to be consistent. They don't have to be discriminatory or punitive in nature. If you allow some countries to come in, despite the fact that they too have even fact they have a good number of cases already established.
Nigeria has 6.
Nigeria, people then wonder, why are you treating Nigeria in this manner? Even at the time when we had just 2 cases, the UK took already this decision.
Yeah.
Whereas the other countries with far more cases. So what is going on? A lot of these countries, they've come to the conclusion that in Nigeria we have no control measures in place. They believe that whatever we do, corruption finds a way of getting involved and stopping us from even implementing to the letter our own safety protocols that we put in place. So, but what the Nigerian government needs to do is to reassure the rest of the world that, look, this thing is not as bad as it seems. We too, the moment we heard that this Omicron variant had begun to terrorize the world, Nigeria also came up with measures to ensure that, okay, those coming into our country, at least we protect ourselves against them. But everyone appears, look at the first set of countries that Canada, for example, decided to move against. Nigeria, Egypt, Malawi. Well, there are other countries with worse cases. You are not talking about those countries. It's just Nigeria that you think you have to know. As long as you do not apply the rule with even-handedness, people will believe that, look, you are being discriminatory, you are being unfair to us. And that's why I support the governors that, look, these countries need to treat Nigeria fairly.
Nico, now when you look at, so I said this during our last discussion, that if COVID-19 were to be something that emanated from Africa, I'm sure the world would have just looked for a way to build their borders and just so that they understand that we won't have anything to do with the rest of the world. Right. Now, something that is not even ours, that was even, I'm sure the first case in South Africa, I'm sure that person might have brought it from that Holland or Portugal.
Belgium, you know. Well, in an attempt to try and answer your questions, what I see is this, that just as Babajide has observed, and as yesterday, 57 countries have this thing. And you have not gone against all those 57 countries.
Why the rush?
Even Nigeria, that has a maximum of 6 for now, Britain already has 146. I mean, 568 already. We are even the ones that you say don't even come to our country. And then we have something that we can use. We have a weapon. The air traffic between Nigeria and UK, you know how much the airlines are making. And I think I saw Nigeria's ambassador on TV some time ago who was describing this as apartheid, some kind of apartheid, you know. Especially, and somebody was joking. He said, oh, these countries are moving against South African countries. And he started mentioning some countries in Europe. You know, I think he's just trying to, be sarcastic. That, okay, you say South Africa, okay, Southern Africa, and they started mentioning Belgium, mentioning other countries that are basically in Europe. Are those countries in South Africa? That tells you that there's something, but let me zero into Nigeria. I rather face Nigeria as Nigeria's own problem. Is this, just as, again, as Babajide has hinted. You see, I have a friend who lives in America. He came to Nigeria through Abuja. He's from Kwara State, and he never came to Lagos. The PCR, right? And that he got was fake. Somebody called him and said, he sent this a private information message on our class platform. He said somebody told him to come and pay. It was supposed to be 30-something thousand. Somebody asked him to come and pay 25. He said no. He'd rather do the correct thing. And it took him round. Eventually, after doing the right thing, it was discovered.
They still gave him a fake.
They gave him a fake something.
Because yesterday, a colleague of ours, if I mention his name, just coming back from UK, he told me that our green this thing. But after taking your jab, yes, he has taken first and second jab. By the time he got to the airport,
the vaccine certificate.
They scanned the barcode, and it was reflected just that he has taken one jab. The second jab did not reflect in it. He started making calls, started running helter-skelter before he was actually allowed to travel out. I'm just corroborating what you're saying to say, that in terms of inefficiency, cutting corners, we have our own problem.
Yes.
Exactly. And we need to face it.
Yes.
Someone that has taken 2 vaccinations.
This is why the rest of the world does not trust us. That's right. They do not trust us. Look, they will not treat Rwanda like this. Not because in Rwanda they have 2 heads. But they know that, that when they want to enforce something, they enforce it diligently.
Yes.
And I'm happy the way they do over there. Whether you are from the UK, they don't even care about the color of your skin. They will apply the rule
to the letter.
So you are coming to their country, you do not determine even the hotel where you stay. They have designated hotels. Before now allowing you to move to even one of the your favorite hotels, they will have run their test and the result will have been out, so they know that you are clean. Even for their tourist sites, it's not all the tourist sites that people can visit now. There are designated tourist sites, and there are designated drivers that pick people from the airport. You are not going to choose for them. That way they are protecting themselves thoroughly, and at the same time the international community will see them as people who are working hard to ensure that this COVID-19 does not have a free reign in their country. The message will be passed across. But if we continue along the path of cheating, people come into our country, it's easy for them to evade detection. They come in, they drop fake address,
fake phone numbers.
they drop fake phone numbers,
They refuse to
so
go
that
back
you
for the
cannot
tests.
trace them. They don't want to subject them to any form of test. It seems that in our country, the system is so bad that even foreigners coming in, they already understand that, look, in Nigeria, you can cut corners the way you like.
Okay, I have my first caller. Ada is calling us from Jos.
Yes, Ada, calling from Jos, Plateau State.
Okay.
Journalist Hangout.
Ada, go ahead,
Tell you
please.
something. Whether you say they are discriminatory, they are doing apartheid, you're on your own. As far as I'm concerned, I don't even believe that we have only 6 Omicron or whatever virus. So the problem is there's a distrust deficit. That is just true. So what do? We should go back to the drawing board and find out why the countries are discriminating against. What of Saudi? And Saudi has placed us on the list. Why are they not writing about Saudi? There is so much insecurity on the ground. Most of them have booked their tickets to go abroad and live us here. They will stay here with us. God bless you. Let's not give up on this country.
Thank you for your contribution.
He's already seeing this as, okay, it starts those governors
Right, that
that
they
they will
will
not.
sit
There
down.
are other places that they can travel to.
It's just Canada and London.
Yes, and they can bypass even your country. They can decide to connect flight to UK.
Yes.
From other countries.
Cotonou,
So
from Ghana.
don't imagine that they will stay here. They will not stay here. They will not stay here. These governors that you see, they are prepared to travel every minute if they get the opportunity every minute. So don't think that anything will make them sit with you here in Nigeria. No. Don't make yourself
Some of them,
happy
they have
by
properties,
thinking
they
that
have
they will stay
families
here.
there.
No,
Yes.
their children are over there.
So-
They will go and meet them. They will find a way. Either they travel through Ghana or through or somewhere else.
All this while
They will go
Emirates
there.
wasn't running in Nigeria.
Yes,
It was
people
only
are
the
going to
country.
Ghana
They
to
will go
connect flights
connect Emirates.
to UAE. They won't suffer in any way. So leave that one.
So ultimately, when we are to look inward now, we are told to still observe the non-pharmaceutical protocols and everything, but nobody has told us about how deadly this Omicron
I think what
variant is.
What WHO says is that what we are sure of is that we are not sure of anything.
Somebody was saying that it's not as deadly as the Delta
it's fresh,
variant.
faster, but it's
What's
not
the
as
name of this CNN doctor?
Sanjay Gupta.
Yes, that is not as deadly as the Delta variant.
Delta variant, yes.
I
And that
don't
it may even
know.
knock off because it spreads faster than the Delta variant and it's milder. It's a little more benign than Delta variants. But the point is this: to really look at the issue that we're talking about, is that I actually think that we Nigerians are good. The way our governors are howling, it just beats me. What you need to do is to come up with stout communications so that whoever is listening to you knows that you are going to, or you have taken precautionary steps to control the thing, and they ensure that anybody who is getting your PCR is getting, let it be transparent. That's all is needed.
And we have checked the record, that okay, how many vaccine have we supplied to Nigeria
so far?
How many people so far? Right. How many people have been vaccinated? What's the percentage out of 200 million?
And about now that's something less than 1 million.
They can't do 3% of their population. That's, we start getting things like this.
Yes, because we have not even done enough to encourage our people to get vaccinated. We are not doing enough. Maybe before now, last year we were much more serious about this thing than we are doing now. But right now we are not pushing harder.
Yes.
We are not pushing harder enough,
and
to get people to get
pay attention to it.
Yes.
Some states told civil servants from so time don't come to the, like Edo State raised it. It became so controversial. Federal government at a point in time gave December deadline for civil servants not to come to office.
Really, how many units of vaccines have we got?
If everybody even showed
for interest, 200 million
people, everybody showed interest. And are we going to be able to vaccinate?
That's the
problem. We are relying largely on donor countries, to provide the vaccines.
And people like the
we are supposed to
deceiving us.
We are supposed to leverage on the vaccine initiative.
That's right.
That government talked about earlier, so that we can produce the vaccines right here in our country.
Okay, I have David is calling us from Ilori, Kwara State. Thank you for joining us, David.
Yeah.
Go ahead, please.
Journalist Hangout.
Yes, you're live.
Yeah. Please, I've been listening to you for long. And what you are discussing is reality. But I don't know where we get here in Nigeria. Everything is just wrong. To get anything right is now impossible in Nigeria. A good example, look at it. We have 4 NNPC. No one can produce refined products. Omicron now, see how the all over the world is treating Nigeria. I don't know how to get to this stage. Please, you have been talking many times. I will listen. But this thing is not even changing the attitude of the people of this country. God will save us in Nigeria. I don't know what to do.
Yes, we are prayerful.
Don't get anything right.
Just keep praying.
Thank you very much.
Our president went to Saudi Arabia to go and pray for the country. So
but when we pray, we also should take action. It's not just praying.
Let's keep praying, man. Thank you, David, for your contribution.